Hi everybody, and welcome to this revision video on personality assessments as part of the psychology of the individual topic for Stage 2 psychology. Let's get started. So, personality assessments are designed to measure patterns or characteristics or traits that individuals demonstrate in different situations. So to try and measure personality in terms of traits or patterns or behavior. Now, it's not only used for diagnosis of mental illness or personality disorders. Personality assessments are used by employers for job and career matching. It's used by universities. It's used in the armed forces and many other work industries as well. We'll go into this a little bit more when we do our topic on organizational psychology, but it's not only used by psychologists and clinical professionals. It's used in a wide variety of different settings and different workplaces. So as we already know from looking at the trait theory, we know that they're an enduring characteristic. So because of that, assessment can help to determine future behaviours because we know traits and the trait theory really focuses on traits being enduring and long-term. That can, using personality assessments catered towards the trait theory and measuring traits or trying to, can give us information which is very, very helpful about an individual, whether it is diagnosis of a disorder or helping them to decide what job or career to get into based on their dominant personality traits and super factors. So, the more modern personality assessments that are used today include standardized self-report inventories, behavior counts and observations, and clinical interviews. So let's go into these in a little bit more detail. So, types of personality assessments, we're going to start with self-report inventories because these are the most common and some of them you may have already seen. So self-report assessments are standardized, meaning that they use the same way on each occasion to measure the same thing. So very much like a school test that you'll do for maths or physics or obviously your exam at the end of the year for psychology, it is used the same way on each occasion to measure the same thing. So for the psychology exam, for example, it's used to measure your knowledge and understanding of the content that's examinable. So when we use personality assessments, it's the same concept. So we are measuring the same thing, which are personality traits and personality characteristics, and they're used the same way to provide a standard of whereabouts on different scales or on different criteria a person sits regarding their behavior. So they require the client to complete the assessment on their own, hence to report on themselves. Self-report inventories make sense. So these are most commonly subjective quantitative rating scales. So we know that they're subject to the individual's own bias, but they are measured in number form. Now, because of that, there is the risk of lowered validity and reliability because, as we know, people can give socially desirable answers, they can lie, they can bend the truth slightly, or manipulate the test to benefit themselves without accurately measuring what it is that it claims to measure, which is obviously their true personality at that time or their traits or their behaviours that they're displaying. We also know through first-hand experience of doing this in class that sometimes our responses will change. So I know several of you have already done some of the personality tests that we've already covered and your results changed. So that lowers the reliability of them as well, so the consistency of our results. So they're informative, they're certainly useful, but scientifically the accuracy and the consistency is questionable. Okay, so let's go through the different types of self-report inventories. So one of the most common and most widely used is certainly the Myers-Briggs type indicator or MBTI. So this is helpful for individuals to understand their emotions and why they would respond in certain situations in different ways. It's very commonly used by schools and universities to help individuals identify suitable career choices based on the personality they give at that time. So we know this already, but 4 scales are measured of varying percentage to indicate an individual's most dominant traits. So this combination usually corresponds with a type and likely behaviours, preferences, career choices, and likely social interactions. Is it perfect? Absolutely not, but it is still a very good insight into what at that time of taking the test it reveals about our personality and our preferences going forward into the future. So there are 16 types that it sorts people into. And as you can see here, these are the 16 types. Now, I know that the online version, the names will be slightly different, but the combination of the letters is the same. So we've got the inspector, crafter, protector, artist, advocate, mediator, architect, thinker, persuader, director, performer, caregiver, champion, giver, debater, and commander. So depending on what percentage of the individual traits will give us will determine what type we are. And also, because of this information, it categorizes us into what we would feel more comfortable in terms of going forward in a career choice, or how we are as individuals and in social settings and making emotional connections with other people. What's interesting about Myers-Briggs is that it is very enlightening, however, it can change. So we know that personality fits into the psychology of the biopsychosocial model, but we also know that there is evidence to suggest that biologically we are born with certain traits, and of course our social environment will certainly influence our traits depending on life events and the people that we hang around with or that we associate ourselves with. So even though we might at the beginning of a year, for example, have the result of the protector, by the end of the year that might be a completely different result depending on what it is obviously that we have gone through that year and in our lives. So it's worth keeping that in mind. Then we've got Eisenhowers Personality Inventory, or EPI. So this is used to assess individuals' specific personality traits while also identifying character strengths and opportunity for growth. So we already know from Eisenhowers theory that there are 3 dimensions, so extroversion to introversion, neuroticism to stable, and psychoticism to impulse control. As you can see, psychoticism to impulse control is not in this actual measure because obviously that is clinically insane or sane. So that's obviously taken out of the measure of his theory. So it's also used as a behavior predictor, again, in social and workplace situations. It does have solid reliability and validity, but it's not as commonly used as the other self-report inventories. So the MBTI, there we go. That's more commonly used rather than Eisenhowers Personality Inventory and a couple of others that we'll talk about later on in this video. Reason being, it is more time consuming and it's not as revealing as the others, and it's not as convenient. So we then have Cattell's 16 personality factors, or 16 PF as it's often referred to. So Cattell identified 16 factors or dimensions of personality which are measured across a continuum, as you can see here. So Cattell believed that variations in personality could be best explained by a model that has 16 variables or traits, and went on to create this test. So it's not as simple as just referring or rating ourselves on a scale of 1 to 8 depending on the 16 factors here. There are more detailed questions, and once those questions are answered, it will place us somewhere on the scale that we can see here. So for example, reserved to outgoing, we answer some questions about putting ourselves in certain social situations where that would be appropriate, and then the test will place us on a scale of 1 to 8. So it's not just a simple, okay, I think I'm a 2 or I'm a 5. We ask questions to get a more specific result. So this is used by psychologists and other health professionals to help diagnose mental illness and how they will manage in certain therapy sessions and different therapy types. It is considered very broad by some, but it is still seen as applicable to different disciplines. It is a very popular choice of personality assessment because it does measure a wide variety of traits and a wide variety of situations. It is seen as a very popular choice among, different disciplines, again, especially by GPs, going back to this third dot point here. So help diagnose of mental illness and how they will manage in therapy. So it is quite useful, but again, the validity and reliability is average at best. Now, then we have the MMPI. So this is the Minnesota Multifaceted Personality Inventory. So this one is much more official and can only be administered by health professionals. So it was developed to assess personality traits in patients with complex emotional disorders, and it is still used today for this purpose. It has been revised numerous times over the years. However, the most up-to-date still takes between 2 to 3 hours at a time to complete, and it consists of 567 questions. So it is very in-depth and very time-consuming. Now, despite this, it is still one of the most widely used across clinical settings. So many psychologists and psychiatrists will use the MMPI because, as we can see here, it gives a very detailed profile regarding certain complex emotional disorders, as I said before. It is now used in the special forces as well to see and test whether applicants will be able to cope with the rigour of being in the armed forces. So it is used not only by clinical professionals, but in other disciplines as well, especially the armed forces, so the Army, the Navy, the Air Force, etc. Now, there's no official version of the MMPI available on the internet, as it is strictly to be only administered by trained psychologists. If this was available on the internet, it may do more harm than good because people may self-diagnose, or it may give inaccurate information if people don't answer the questions truthfully. So this is to only be used by professionals and administered by trained psychologists. So any versions on the internet, I say versions in quotations, are made up and not the official test. So we can see here that it provides information across a wide variety of emotional complex mental health disorders. So hypochondriacs, depression, hysteria, psychopathic deviance, paranoia, schizophrenia, etc. Now, we don't only use self-report inventories to measure personality. We have to look at other methods of measuring personality that are not as subjective and not as biased in certain instances. So one of the most popular choices of personality assessment by professionals and psychologists are behavioral observations. So this is a tool that's used for observing, describing, explaining, and predicting behavior. Now, this is used, of course, in clinical settings. It's also used in educational and workplace settings. So workers, students will be observed in their natural environment of school and work, and notes are taken. It's used, again, in other disciplines. Schools and kindy by teachers use behavioural observation techniques to observe their students to make sure that they are doing what they need to do, and also observing their behaviour in terms of who they are as a person. So the participant or client is, again, in their natural setting of work, school, or home. And unlike self-reports, behavioural observations are used and assessed by a professional, which allows a little bit more objectivity in the findings of someone's behaviour. So we know that self-reports can obviously have bias and too much subjectivity. Behavioural observations can be a more objective way of finding out about someone's behaviour. Now, obviously, it isn't perfect. It's never going to be 100% valid in all instances, especially if we're talking about observations. So the perception of aggressive behaviour may be different from one professional psychologist to the other, or they may be subjective in how they view the behaviour that they are observing, but it is still seen as more valid or more objective than self-reports. So that's why it's a very popular choice. Speaking of which, behaviour counts are also done. So, for example, how many times will a child show disrespectful behaviour in a 1-hour lesson? So we can actually count how many times a behaviour is shown, and that brings some quantitative data into the observations, which is seen as ideal. So we can get both qualitative data, where we write down our observations, and we can get quantitative data with counting how many times a behaviour is shown in a specific time period. These behaviours are then determine whether they're in excess, so too much, or a deficit, which is too little. And checklists are often used, especially with behaviour counts, to see and measure, is there an excess in aggressive behaviour, for example, or not enough of social behaviour, depending on what the actual behaviour is that we are observing. Now, clinical interviews is the third way in which personality assessment is completed. So clinical interviews, as you can probably gather, is what a psychologist does the majority of the time, especially clinical psychologists. So it's an interview between the professional and the client, which helps to gather information about them. The client is asked to describe the onset and development of their problems or their symptoms, and then patterns and/or themes are discussed once they share that information with the professional. So there may be consistencies in their behaviour or consistencies in their triggers when their symptoms are actually more prevalent. Other sources of information are often used as well. So interviews with the family, friends, teachers, whoever is appropriate to that individual. That's really important, because if we only interview the client, for example, we may be missing other perspectives and other vital information by those close to them. So we always try, in an ideal world, to interview not only the client, but the people in their lives to get more comprehensive data. Now, a good interviewer should be warm, genuine, accepting, and understanding. We know that from going back to the humanistic theory, which we covered, that was developed by Carl Rogers and his client-centered therapy. Open-ended questions are far better than closed-ended questions. So the goal is to allow the client to feel as comfortable as possible, but to encourage conversation, because the more they talk, the more data we can gather and the more accurate a diagnosis we can achieve. So open-ended questions such as, tell me how you get along with other people, is far better than a closed-ended question, which is, are you a difficult person to get along with? The tone of the questions are very different. The closed is very accusing and it doesn't encourage conversation. It's just a yes or no response. Whereas the open-ended, tell me about how you get along with other people, encourages conversation and it's non-judgmental. It's a very neutral way of asking about the subject at hand. Now, it's worth mentioning that older types of personality assessment are quite popular and are quite prevalent in film and TV. So I thought I'd spend a little bit of time very quickly recapping some of the more popular older types of personality. But as you can see here, I want to make this very clear that these two assessments, so the Rorschach blot test and the thematic apperception test, are not used in modern personality assessment. There is just a complete lack of validity and reliability. But they were among the first tests used, especially by Freud, in trying to tap into the unconscious mind. But it's interesting, so we'll spend a little bit of time going through what they're about. So the Rorschach blot test was developed by Rorschach, and the client was asked to look at 10 ambiguous ink blots and to describe what they see. This is one of the ink blots in the test here. So different ink blots measured different aspects of behavior and personality. So certain blots were catered towards measuring schizophrenia or relationships with parents or sexuality at the time. And anything aggressive or overly sexual or dark indicated possible presence of mental illness. And of course, it obtained qualitative data because the client described what they saw. Very similar to that was the thematic apperception test. So the client was asked to look at a provocative image and describe the scene, the plot, the relationship, what's going on. And again, this is an example of a thematic apperception test here. Very similar to the ink blot, so any aggressive, overly sexual or dark responses indicated cause for concern and possible indicator of a mental illness. And again, qualitative data was obtained. Now, as you can probably gather as science students and psychology students, there's no validity or reliability to correlate here. So just because someone says something aggressive or dark or sexual does not mean they have a personality disorder, for example. So these are not used as an assessment tool in modern day psychology to diagnose mental illness or personality disorders. If they are used, it's to obviously teach the history of where we've come from when it comes to personality assessment, or used in a more creative sense. So used by creative writing students or something similar like that. So to finish up this presentation, we're going to go through personality assessment strengths and weaknesses. So let's talk about the strengths first. So the qualitative tests allow descriptive and detailed responses of thoughts and feelings, which give a greater understanding of personality. So this is certainly the case with clinical interviews, behavioural observations, and so on. And quantitative tests allow data to be gathered quickly to give an overall picture into personality and make future predictions about behaviour. So this is, again, certainly the case with the Myers-Briggs, the 16PF, and Eisenhowers Personality Inventory. So we can get data quickly and it gives us an overall indicator or picture. This is also the case with the Big Five online test as well. They are very convenient, again, for workplaces and psychologists to get information about someone. So again, it's quick and convenient, the only exception obviously being the MMPI, which is only used in a clinical setting anyway. So really, qualitative and quantitative evidence are gathered. The qualitative gives us descriptive information. The quantitative test is quick and convenient, which is excellent. And it gives us an insight into someone's traits and behaviors at that time. However, there are some weaknesses overall. A client may get unwanted self-knowledge from these tests, which causes discomfort and may reduce self-esteem and may make the mental health disorder or personality disorder worse. So that is a risk with taking any form of personality assessment. It's also very difficult for most personality tests to be considered completely valid due to its subjective nature. So even behavior counts and behavior observations, yes, they're seen as more objective, but again, it depends on the perception of the psychologist or the professional interpreting what they see. That may differ depending on the professional that is obviously doing the work. So 100% validity and reliability in personality is very, very difficult to achieve. And of course, this is definitely relevant to the self-report scales, where people are biased and may lie and give socially desirable answers. There's also a lot of extraneous variables to consider. So the mood of the person taking the test on the day, if they know they're being watched, so observer bias for behavioral observations, and even in clinical interview settings, a lot of extraneous variables may affect what is said. So consistency and replication of personality assessments is quite important to make sure that we're getting reliable results and to allow for an accurate diagnosis as possible. Okay, everyone, that wraps it up for this revision video on personality assessments. I hope you found that useful. As always, any questions, let me know.